The Florida Department of Health cautions those who swim frequently in Florida lakes and rivers about the possible presence of a brain-eating amoeba. While contact with this amoeba is rare, it is usually deadly. We're taking action for you with details you need to know. As temperatures rise and kids are out of school looking for ways to cool off, a warning about a rare but deadly danger lurking in our fresh waters.
The Florida Department of Health has put out a notice for the state and all its residents and visitors for Naegleria Fowleri, which is an amoebic disease that affects people very quickly. If you get this disease or this amoeba, it will have effects on your body within 5 days. So it's very important that people know what it is and understand how you get it.
The amoeba lives in fresh waters and typically is found during warm periods of time.
So as you see the temperatures in the ponds and the lakes and the rivers rising, we want to be very careful not to be in the shallows, stirring up the muck where this amoeba can be found. And the route of entry is through the nose. So people who are water skiing, for example, in a lake are going to watch and see how much muck has been stirred up, and then if they happen to fall off the skis and go down, when the water's charged up the nose is really the chance that the amoeba has to connect with the body.
Symptoms to look out for include headache, fever, vomiting, becoming disoriented, having seizures or hallucinations. If you have any of these symptoms after you've been swimming in a warm body of water like a lake, seek medical attention immediately.
Since 1962, we've only had 123 reported cases in Florida. However, in Hillsborough County, we did have a death in 2009.
The death was a child, and the average age of amoeba victims is 12, perhaps because young people are more likely to jump into the water, dive to the bottom, and stir up the areas where the amoebas live. So how can infection by this amoeba be prevented? Well, just don't go in the warm, murky lake areas, or if you do, use a nose clip when you go in the water.